My name is Shawntel Wilson. Today I will be talking about canine parvovirus. Canine parvovirus is a species-specific virus that can infect both domestic and wild dog breeds. This virus is identified as a small, non-enveloped, single-stranded DNA virus that results in a lethal infection to its host. It was first discovered in 1978 and since then has mutated into 3 strains: CPV2A, B, and C. Unvaccinated and immune-compromised canines between 6 weeks and 6 months are the most susceptible to contracting this virus. Common symptoms include vomiting, lack of appetite, lethargy, depression, fever, and diarrhea. Due to the symptoms mimicking feline panleukemia virus, or FPV, some studies have theorized that canine parvovirus arose as a mutated version. CPV2 commonly spreads through direct contact of feces of an infected patient and can live in an unsterile environment for up to a year. Bleach is the only universal killer of the virus, though multiple treatments are often needed. Supportive care in hospital is recommended due to no antivirals existing. Patients often do not tolerate oral treatment at home and are needed to be hospitalized for an average of 2 to 7 days with crystalloid treatment, correction of hypoglycemia and electrolyte disturbances, antiemetics, analgesics, and nutritional support. This virus can lay dormant in the patient for up to 3 months after symptoms have stopped. Mortality rates without treatment remain at 90% and is decreased to between 5 and 20% with aggressive veterinary treatment. Historical findings suggest that patients who are most likely to contract the virus are intact males who are between 3 and 6 weeks, have no vaccines, and are one of the following breeds: Rottweiler, Doberman Pinscher, American Pit Bull Terrier, Labrador Retriever, or German Shepherd. Findings also suggest that patients that undergo hospitalization stay an average of 2 to 7 days in hospital before returning home. There are no to-date correlation between geological location and an increased risk of domestic canines contracting the virus. It is suggested that countries with large wild dog populations may be at greater risk, but there is no conclusive data of this correlation. There is not enough research regarding fresh frozen plasma transfusion in parvo patients to establish a trend. Data was collected using EasyVet software for Salt Lake City Emergency Veterinary Center Advanced Veterinary Care. A total of 991 patients were extracted from 2017 to 2019 due to a billing trigger in the system that indicated an IDEXX parvo snap test had been run for that patient. From the total data count, 31 patients were eliminated from the study due to their feline status and inability to contract canine parvovirus. The remaining 955 patient records were evaluated for parvo positive or negative status. Only 192 samples were marked as parvo positive, and data was extracted for analysis. Parameters for study from each patient record include age, breed, number of reported vaccines, treatment types, identify as outpatient, euthanasia, hospitalization, or none, and if the patient survived with treatment. Additional data retrieved only for patients that were hospitalized includes days spent in hospital, if the patient received a plasma transfusion in hospital. Names of patients were excluded from the data set to protect owner and patient privacy. The primary way to prevent canine parvovirus is through 3 sets of vaccines that puppies receive between the ages of 6 and 16 weeks. Each vaccine should be given 3 and 4 weeks apart. Patients must receive all 3 sets of vaccines to ensure appropriate protection against the virus. Missed vaccines at any set result in an increased risk. This figure reveals that 60% of patients observed had between no vaccines and 1 set of vaccines. Approximately 20% of owners were unsure of their pet's vaccine history and were categorized as not applicable, or NA, in the dataset. Puppies are the most susceptible to contract canine parvovirus between the ages of 6 weeks and 6 months. This figure reveals that patients observed at advanced veterinary care, 46% of parvo patients were between the ages of 3 and 4 months. A total of 57 patients, or 30%, were older than 6 months old and outside the global range for being likely to contract parvovirus. Hospitalization is recommended for treatment in the majority of cases due to worsening symptoms and difficult oral treatment at home. The majority of patients are hospitalized for an average of 2 to 7 days. This figure reveals a total of 13% of pet owners who received a parvovirus diagnosis opt for humane euthanasia, following 42% requested for outpatient treatment, 38% hospitalized, and 7% refused treatment of any kind. The resistance to hospitalize as recommended in many of the cases was observed to correlate strongly with the owner's lack of finances. Additional findings through data collection revealed that the year 2018 contained the most parvovirus positive cases, with a total of 81, followed by 2017 with 64, and the year 2019 with the least at 47. Some studies loosely correlate that intact males are more likely to contract the virus than intact females, spayed females, or neutered males. This is especially true in older age groups. From the data collected, 53% were intact males, 39% were intact females, and 12% were neutered males. 4% were spayed females. Data collected from advanced veterinary care in Salt Lake City, Utah agree that intact males between 1 and 3 months that have no vaccines were the most likely to contract the virus. The data also agree that the American Pit Bull Terrier, Labrador Retriever, and German Shepherd were breeds more likely to contract parvovirus. Data excluded breeds Rottweiler and Doberman Pinscher and instead included American Cattle Dog Mix, Border Collie Mix, Labrador Mix, and Pug. This figure reveals a total of 73 patients that were hospitalized for aggressive treatment. 53% of those patients were hospitalized between 1 and 3 days. The remaining 47% stayed between 4 and 8 days. Overall, patients stayed for a mean of 3 days in hospital before continuing with oral treatment at home. Fresh frozen plasma has been recorded to provide parvovirus positive patients with immunoglobulin and serum proteinase inhibitors that have the potential to neutralize circulating antigens and aid in minimizing the systemic inflammatory response. Of the 73 patients hospitalized for aggressive treatment, only 8 received fresh frozen plasma transfusion. Following exposure, aggressive treatments improve the mortality rate from 90 to between 5 and 20%. Data collected from advanced veterinary care reveal a mortality rate of 8% for parvo patients who undergo aggressive treatment in hospital. Due to fresh frozen plasma being a controversial form of treatment within veterinary medicine, little data is available and even less is known about the potential benefits. In this graph, of the 8 patients who received a fresh frozen plasma transfusion, only 50% survived.